Hi, I'm Gregory Bader, your host of Graceful Aging. On today's show, we're going to talk about a troubling behavior that may occur in your household, wandering. You know, we're all travelers, we all like to travel, we all like to wander, we learn a lot from wandering. But sometimes wandering, because of Alzheimer's or dementia, can be troublesome. It can cause burdens on a caregiver, and it can cause burdens and dangers to the individual. We've asked Lisa Gardner, who is an expert on Alzheimer's and wandering behaviors from the American Alzheimer's Association, to be our guest today. Stay with us. Lisa's going to provide a host of valuable tips that you might be able to use in your home to make your loved one safer and stay at home a lot longer. Join us. Thanks for joining us today on Graceful Aging. Let's introduce you now to Lisa Gardner. Lisa, thanks for being with us on today's show.
You're very welcome.
You didn't wander around aimlessly trying to find the studio. You were able to find it all right?
I found it very easily, actually. Your map was wonderful, so thank you.
You know, one thing I've read as far as with Alzheimer's and dementia patients is they have difficulty with spatial mapping. You and I can use a map, but somehow that goes away, doesn't it?
It does. That's one of the symptoms of dementia, actually, is you and I, we have the ability to know and to remember how we got from point A to point D. We have what's called cognitive mapping skills, where we can kind of pinpoint the steps we need to get from one place to another. And because of the short-term memory loss and the confusion with dementia, it's much harder for individuals with Alzheimer's and other types of dementia to be able to do that ability, yes.
Now, we've had another show that talks about that dementia is the big category and Alzheimer's is one aspect of dementia.
Yes.
And that's your understanding as well, right?
Yep, absolutely. That's actually one of the most common questions we get is, what is the difference between dementia and Alzheimer's? Is it the same thing? And you're absolutely right. Dementia is just that classification of symptoms. Something is happening. So dementia is, if you think of it as like the umbrella term. And Alzheimer's disease is just one type of disease of the brain that causes these dementia symptoms to occur. So just really quickly, for example, people can get dementia from having strokes. They can get dementia from having a vitamin B12 deficiency. There's lots of things that can cause dementia, and Alzheimer's disease is just the most commonly diagnosed type of dementia.
And one behavior form that we're going to focus on today's show is this behavior of wandering.
Yes.
And it seems to be pretty prevalent with dementia cases and Alzheimer's cases, doesn't it?
Oh, absolutely. It's I believe the statistic now is 6 out of 10 individuals with dementia will wander at some point, and over 50% of those people that wander once will wander again. So it's probably one of the most feared behaviors, I'd say, of dementia. Excuse me, just because that is one of the behaviors that can put people with dementia in harm's way. But yes, wandering is very prevalent among people with dementia, and everybody with dementia is vulnerable to it.
Now, how does a family start to see that? You know, what are some of the behaviors that a family might notice with an older person who has that condition to maybe catch it beforehand and prevent, you know, a dangerous situation?
Sure. Well, some of the signs that wandering might be on the forefront. For example, you might have somebody with dementia who is returning home much later than they used to from going out. So for example, someone who goes to the corner store and usually is coming back in 20 minutes, they're gone for an hour and a half, and they really can't say why they're late, or they might make an excuse as to why they're late. Another sign also might be they get lost in familiar environments. So for example, an individual, using the corner store example again, who used to be able to know exactly how to get there, and now they need directions on how to get there. Individuals with dementia who all of a sudden are not, well, I shouldn't say all of a sudden, but who are starting to not recognize their familiar surroundings. So
you mean like their own home?
Right, absolutely. So being at home and saying, I need to get home. You know, this is not where I need to be right now, because that's showing that the disorientation and the confusion is getting worse. You know, somebody with dementia not recognizing familiar people anymore, because that's a sign that the confusion is getting worse, and that's usually when wandering will start to occur.
Now, I can't remember people's names as well as I did before, but that happens to everybody,
That
right?
happens to everybody, yes. There's a difference between typical memory changes due to stress, fatigue, or typical aging versus dementia. There's a big difference there.
I've heard that individuals, some of the wandering behavior might even be an inability to know where the bathroom is or where the kitchen is or the dining room in their own house.
Sure. Well, we were talking about the cognitive mapping a few minutes ago. And so somebody sometimes with dementia might be heading toward a specific destination, and on the way they forgot where they were going or they forgot how to get there. So they kind of get lost from going from point A to point D, we'll say. They kind of get lost in the middle of it. I'm sure we've all had, the viewers and you as well, have had the experience where we're driving and all of a sudden we kind of think, wait, how did we get here already?
Sure.
You know, where did the last 5 minutes go? Yeah. And we've all had that experience. And for someone with dementia, they experience that a lot more frequently, and they're not aware that they're experiencing it. So that's absolutely another sign. They can't find those familiar destinations.
Now, what about with some chore activities or just activities around the house? I've heard that there can be very busy activity, but that could be a sign of wandering around the corner.
I think kind of what that's referring to is just the restlessness that sometimes can cause wandering. And sometimes people with dementia will do a chore, but there's nothing productive being done with it. So an example is I used to work with a resident who used to constantly unpack her closets. And she wasn't going anywhere. She wasn't doing it for any purpose, but it kept her busy and she just kept doing it. So it was I kind of call it the restless energy, just doing something. They just need to stay active, but it's not really producing anything, which is okay too. We sometimes tell caregivers, you know, if they're being active and they're not harming anybody and they seem content, you know, we let this lady unpack her closets if it made her happy, you know. So, but absolutely, that can be a sign of wandering because it's just showing sometimes they have this restless energy that they're trying to get out.
So if some of those signals or signs appear, then people could start developing some of the other preventative steps that we're going to talk about in the second half of the show.
Yeah, absolutely. I think those are things to kind of be some red flags. Not everybody will wander that has dementia. I think it's important to say that. But these are some signs to think, okay, maybe I need to start preparing in case this behavior does occur.
If I'm diagnosed with, or say the onset of Alzheimer's or dementia, where does wandering fit in? Is it a late stage behavior or an early or a mid? Where does it fall in?
I would say mostly you see it in the middle stages. Usually individuals in the early stages are early enough to know if they get lost, and they're early enough to know to ask for directions if they're lost. For someone in the middle stages, usually they don't even always realize that they're lost. They don't realize that they've wandered into an unsafe environment. In the late stages, kind of one of the misconceptions is that, you know, if they're bedbound, they can't wander. But you do still see individuals in the later stages still being restless, trying to get out of bed, trying to get out of wheelchairs, and that can also be a symptom of wandering too. So you see it more in the middle to later stages, I'd say. But usually the red flags appear, I would say, late early stages is usually when the red flags kind of start to appear.
2 to 4 years maybe after the onset?
It really depends. It really varies on the person. I'd say in general, I think that's a good average, but people can vary as far as their progression of the disease.
Now, are there particular types of people? You know, if I was very active and social before I had the onset of the disease, would I be prone to wandering more? Have there been any studies of behaviors before and after?
You know, no, not that I'm aware of. And I guess what I would say to that too is one of the symptoms of dementia or Alzheimer's is personality changes. So you can have somebody who used to be really active and a go-getter earlier, and they completely change when they get dementia and vice versa. So because personality changes happen, have not heard of any, like if you were outgoing or energetic when you were younger, you're more prone to wandering. Not to say the studies aren't out there, I just personally haven't been aware of those studies.
So there's quite a few people that wander from one year to the next. I've heard numbers of like in excess of 30,000 people wander away from home or from a facility. Yeah,
I think I saw 350,000 was a statistic that have wandered. And you know, you think of the statistic I said, 6 out of 10 people with dementia will wander. That's a lot of people. And I would suspect that it's probably on the rise because more people are being diagnosed with Alzheimer's. So I think more attention is being put on wandering and other behaviors that are associated with Alzheimer's. So I'm sure we might even see it more in the future.
Are there some other triggers as far as for why a person might wander, say medications? How can medications?
Medication, sometimes what we tell people is that if you notice somebody with dementia who is a lot more restless kind of all of a sudden, or they do start wandering and getting more confused when they've started a new medication, to talk to the doctor about it, because sometimes it can be a side effect of a medication, or something like restlessness or agitation can be a side effect of a medication, which can lead to wandering. So it might not be that the medication is causing the wandering, but it's causing a trigger to create the wandering, if that makes sense. So we tell caregivers anytime they notice a change when there's a new medication that's involved to definitely let the doctor know, because there could be some correlation between the medicine and their new behavior, or an exacerbation of behavior too. Maybe someone who wandered a little bit but now they're completely restless 24 hours a day and they just started a new medication. Definitely something to let the doctor know about.
So it's kind of part of an investigation. You almost
Yes.
have to put your Sherlock Holmes hat on.
Yes, we call caregivers compassionate detectives. That's kind of their new role, because they're looking for all these clues to try to put the puzzle pieces together. Sometimes you never can put all the puzzle pieces together, but all we can do is give them the tools to try. So, yeah.
Okay, so say I see these signals happening with someone in my home. Let's put on our Sherlock Holmes hat.
Sure.
And what could be some of the reasons why they are moving about without reason?
Yeah, well, kind of the general rule of thumb that we always, well, I should say that we or I always teach caregivers is that behind every behavior there's a reason for it. It's kind of their way of communicating to us. So for example, I can say to you, I'm in pain, I'm hungry, I'm thirsty, I'm lonely, I'm scared. But for someone with dementia, they can't always express that. So they're going to try to communicate that in a behavior, and wandering is no exception to that. So we always
wandering is one of those behaviors.
Yes, absolutely. Okay. So wandering is one of those ways that they're communicating that there's some kind of unmet need that's not being met. I'm sorry, what was the original question? I lost my train of thought.
No, you were right there. As far as, you've got to play detective, so a person might be hungry and might be expressing it by wandering around. What are some other things? Thirst?
Yeah, so just, you think of like the basic needs, so hunger, thirst. If they're in pain, sometimes sitting down for too long is painful for them. Also too, psychological or emotional needs. They might be scared, they might be lonely. They might be bored, they might just be trying to find something to do. Also too, we kind of talk to caregivers about trying to find the balance between overstimulating somebody with dementia and understimulating them. Because if you put someone with dementia in an environment that's overstimulating, so for example, if you think of the five senses, touch, sight, hearing, smelling, and tasting, if these senses are being too overwhelmingly stimulated, the person with dementia is going to want to leave because it's too much for them. That can trigger wandering. Or the opposite, they're in an environment where there's no cues, there's no clues in their environment of what they're supposed to be doing. That can also trigger wandering because they're bored. They don't know what they're supposed to be doing. So those kind of things can trigger wandering as well. Also, too, another trigger is, we talked about the confusion and how people with dementia tend to go into their own reality. So we kind of talk about aimless versus purposeful wandering, where aimless wandering is somebody who just kind of is pacing. They don't really know why they're moving around, why they're wandering. They just are. Their mind is telling their body, you have to get up and move, but we don't really know why. That's where the Sherlock Holmes detective hat comes in.
Right.
Then there's purposeful wandering, where somebody with dementia is confused and they feel they have an obligation that they need to fulfill. So for example, someone who's been retired for 40 years, but they have to get to work. Or somebody whose kids are all grown up and they say, I have to go feed my children, they're waiting for me at home today. So there's kind of those two different types of wandering.
Well, we're going to set our Sherlock Holmes hat off to the side for a minute, take a short break, and come back with solutions.
Okay.
So stay with us and we'll be right back on this vexing issue that might be in your house. When selecting a residential care facility, you've got to ask yourself, how can you assess the competence of the residential facility manager? Take a look at a number of factors. The length of their tenure as a manager is important. How long have they been in this location? How long do they anticipate continuing in this location? Have they ever received any commendations for their work performance? When? If it has been some time since they were last commended, ask them why it's not happened more recently. Have they been cited for any deficiencies in their work performance? Have they ever been involved in a regulatory investigation of any kind at this or any other facility. Ask them about those occurrences. How were they involved? How did they handle it? What became of it? What did they learn from that experience? An excellent manager projects a commanding presence. Direct care staff should be in awe and have full respect for a manager's passion for people. A manager is typically present during regular business hours, leaving 16 hours each day when their aura must promote excellence. Excellent managers know and use everyone's name with the pride a mother would display for a young child. There should be hope and love exuded in every utterance of a staff or a resident's name. Strong managers continually model excellent care practices. Facilities typically conduct in-service training programs that are useful and important. An excellent manager continues those trainings by modeling practices alongside direct care staff in a proactive, not demeaning manner. In other words, as you tour a facility, you should notice how the manager teaches and models good practices. Do they bark orders, or do they use more sophisticated techniques? How is the staff reacting to their guidance? How will they react when the manager is away from the facility? I want my loved one in a facility where the manager creates and ensures a living setting of safety, health, and dignity. Make sure your assisted living search critically evaluates the manager. I'm Gregory Bader. I believe in graceful aging. We have a lot more important information to discuss with Lisa Gardner from the Alzheimer's Association about wandering and when it becomes a problem. And it can become a problem if people don't understand safe areas, unsafe areas, and supervision or no supervision.
Yeah, there's, a lot of people look at the negative aspects of wandering first because that's what we hear about the most. But there are some positive aspects to it that I'm sure we'll talk about as well. So there are the two sides to it.
And people can do quite a bit in terms of unsafe areas in your own home, like cleaning products and stairwells. What are some things that they can do?
Sure. Well, to be proactive about it, some of the things we talk about is the first thing is, locking the medicine cabinet if you can, just because, people with dementia can sometimes get medications confused or take the wrong ones. So locking the medicine cabinet. We talk about anytime somebody with dementia is wandering or on the move, they're at a risk for falling. So removing things in the home that are clutter or things that can be a tripping hazard. So like throw rugs are a very common thing. Wires, if you have a pet, having cat toys and dog toys all over the floor. So removing those fall risks. Also, too, there are some companies. Technology is advancing so much now.
Well, we're gonna talk about that in a little bit, but I want to ask you, as far as time of day, is there any one time of day that a person might wander more than another, and should that be part of my investigation?
Definitely, we tell people if wandering is a reoccurring behavior to document it. And one of the things we say to document is when it happens, because you might find a pattern. There is something that a lot of people refer to known as sundowning, where they don't really know why exactly this happens, but between the hours of maybe 3 p.m. to like 8 p.m., people with dementia just tend to be more confused. So wandering will sometimes increase during that time of day. One theory is that, somebody that used to work their whole life, the end of the day, they went home. That was their routine, So, of course, they want to go home. That's where they want to be at the end of the day. I've heard things like the gravitational pull of the moon. So we don't really know exactly why. So that might be a time of day. But also, too, you might notice wandering occurring more when you take somebody with dementia out of a familiar environment. So, for example, if the person with dementia has to go to the hospital for something, you might see behaviors occur more because we're taking them away from their familiar, structured environment, which is very important for people with dementia when it comes to caring for them. When you move somebody sometimes into an assisted living or a memory care unit, you might see wandering occur a little bit more in the first few weeks because they're readjusting to a new environment.
Well, in a situational setting, I would know that I would have to pay more attention or closer attention. But if I find that time of day, what are some proactive steps that I could take to prevent dangerous wandering?
Well, one thing I would say is if you know that your loved one is more prone to wandering at the in the evening, what we usually will say is if you know that's going to happen, try to get them involved in an activity that they enjoy prior to that. So that way, if they do, because again, wandering is triggered by something, whether it's anxiety, boredom, whatever those things we talked about. So if you can get them involved in something earlier to the point where when they usually tend to wander, they're engaged in something. Not to say you might not have to deal with it later, but you might be dealing with somebody whose anxiety level is here versus way up here, and then you can much more easily intervene and redirect with them. So getting them engaged in something prior to the event, that's something they enjoy and something not too overwhelming for them usually can help.
But they're following me all over the house. I can't, they keep
Yes.
following me all over, and you're telling me to be proactive. How can I do that? How can I maybe stop someone from following me all over the house?
That is the $1 million question that a lot of people ask. And that's why I say a lot of caregivers, they really need help. They really need somebody that can step in and be there with the person too. Because you think about it, that person is their security blanket. It's the person they're familiar with. It's the person that gives them comfort. So of course they're going to want to be with that person. So, what I will sometimes tell people is, whether it's from an outside resource or somebody identify 1 or 2 people that you can call on that can come over and assist you, just to be a distraction for that purpose. So for 5 or 10 minutes, you can walk away. I've had caregivers literally lock themselves in the bathrooms for 10 minutes just so they could breathe and get away from the person. And as long as the person is safe, that is okay too. But in situations like that, you really do need some help. I think the person does need help.
What about saying, well, stop following me, sit right here, why are you following me? What about the behavior of questioning and quizzing to try to find out why the person is acting that way? Does that work?
No. People with dementia, they are very big on nonverbal communication because their verbal communication is more limited. So they're going to pick up on the nonverbal cues. So if you're agitated, if you're stressed, if you're angry, that's what they're going to pick up on, and that's what they're going to start acting more toward. So telling them, now, don't follow me, sit down, don't go anywhere, the first thing they're going to want to do is, well, number one, they might not even know what you mean by that. Number two, you say, sit down here. They might sit down for a second, but they're not going to remember, and they're going to get up again. So that, trying to orient them to reality and give them instructions might not always be the best approach.
So you're almost guaranteeing more frustration for yourself when you release that anger and direct it to them.
Right. We always tell caregivers that the general rule of thumb is to keep the person with dementia as calm as possible and as anxiety-free as possible. Because again, the more calm and anxiety-free they are, the easier it will be for you to redirect them, for you to give them instructions possibly. But if you're dealing with somebody who's way up here, it's going to be much harder for you to do that. So the best thing you can do is keep the person with dementia calm in the moment, and the thing that is the least effective is arguing with them and trying to reorient them back to reality. That's just going to make them more agitated and upset. So we always tell caregivers, the first thing you want to do is just get where they're at in their reality. If they say they have to go to work, oh, where do you work? What's your job? Asking them questions to kind of talk a little bit about it. But if somebody with dementia were to say, I got to get to work, and I were to say, no, you've been retired for 45 years. There's no job that you need to go to. It's like someone telling me I don't work for the Alzheimer's Association. So we have to get into their reality, and once they know that they can trust us, and we do care about their well-being, and we do want to make sure that their needs are being met, it's much more likely for them to be redirected versus if they're agitated and upset.
Well, that's a huge skill. So
Yes.
Redirection is that another way of saying distract?
Kind of, yeah. Kind of an example I'd say for redirection is, let's say you have somebody who is dying to get to work, and I start asking them about this is actually a real example I had to deal with. I started asking them about their job, where did they work? And eventually it turned into them wandering, trying to find the bus to get to work, to us just walking together, talking about their job. And once I noticed they were calmer, and that's the key. If I tried to do this when they were still agitated, it would not have worked. But when I sensed that they were much calmer and we were just having a discussion, this was at a long-term care facility, and I had said, why don't we go, and I think dinner is ready, so why don't we go in and get some dinner, and I'll check in on this for you and see if they're open today. And she went right in and sat down for dinner. So, I've had situations where that doesn't always work, but you'll have much better results if you get them calm first.
And what if someone has wandered away from their home, or in a store they've wandered away, and then I find them? How do I get them back? How do I, same principles, redirecting?
Is this someone you mean?
It would be someone I know.
Yeah, so, if somebody did leave a safe environment, I actually had to do this with my grandma before. I just went out there and I said, hi, Grandma, where are you going? And she would answer me. Again, we just kind of had a dialogue as far as, again, I just went into her reality.
So engage that reality.
Yep, and, it's kind of, we always say turn negatives into positives. So, for example, this is kind of a cliche kind of example, but if I say don't think about pink elephants, you're going to think about pink elephants. Mm-hmm. So instead of saying something like, no, you can't be outside, it's too cold, why don't we go inside where it's a little bit warmer and we'll wait for it to warm up a little bit, turning kind of a negative into a positive.
Okay. Environmentally, as far as with our home, let's talk about some of the things people can do to discourage someone from wandering outside in unsafe areas, whether it's too hot or too cold. So what about night lights and doorknobs and doorways? What can we do?
Yeah, so, again, people with dementia take cues from their environment. So we've had caregivers that actually disguise the doors to where it doesn't look like a door.
And how can you do that?
So we've had caregivers that actually put like a sheet over it with a mirror and a plant. So when they get to the door, it doesn't look like a door. And they kind of they see the mirror and then they kind of get redirected and they go away from the door. So I've heard of caregivers doing that. I've heard of caregivers putting plastic tape strips in front of the door because that has to do with their visual spatial processing in their brains, and they, for whatever reason, think that tape is holes in the floor.
So if I've heard as well of putting, say, a black piece of construction paper by a door, and it triggers a manhole cover, and all those old cartoons of falling in the manhole.
You actually I've seen in long-term care facilities people with dementia stepping over the checkered floors because they think the checkers are holes in the floor. So that's something you can do. Also, too, there are places out there that will sell alarms that you can put in. So the one thing you don't want to do is lock the person with dementia in the home, just because that can be a safety hazard if there's a fire or they need to get out for some reason. So what we sometimes will suggest is there's places that can come in and actually install alarms. So if they open the door, an alarm will be triggered. If they, for example, if they get out of bed, there's some places that have sensory mats that the caregiver is alerted that they're out of bed.
And those are relatively inexpensive items too, I've heard.
I think it kind of depends. I don't really know the price value of them, but I know people that have been able to afford them and to get them.
Back to doors for a minute. I've heard that you can put, or maybe should put, like a child safety lock on the top or the bottom of the door in an unusual spot.
Yeah, where it's not where they would go immediately to look for the lock. So yeah, some people will put them higher on the door or lower on the door, so it's not right in eye view.
Now, this is counterintuitive. We've had a lot of shows about how you want to help someone get up out of a chair to prevent falling, but now I've heard in the case of where you have a wandering behavior that you might want to have a big comfy recliner and have the person park in that recliner, and it makes it a little bit more difficult to get up and move around.
Yeah, I think that kind of relates to like restraint-free care. Back in the days we used to, you'd see people tied to their wheelchairs. You'd see people using alarms if they get up, but that can be scary for the person and it can cause them to fall. So they're, where I used to work, they used to have those and they're much more comfortable too, where they're in a recliner chair. And I think the whole purpose of that is they still have the freedom to move around and they're just much more comfortable, but they can be monitored in that way.
Now, to be on the safe side, if I have someone with a wandering behavior and I want to keep them at home and want them to be at home for a lot longer, should I prepare for an emergency? And
Oh,
if
absolutely.
So, how can I prepare for an emergency?
Yeah, you always want to just plan for the worst, just because the worst time to plan is when you're in a crisis. That's what I've always learned. So a couple things to keep in mind is I always tell people have a recent photograph of the person available in case they ever were to wander out of the house and go missing. That way you don't have to search for it at the time. We know the first 24 hours is the most crucial time to find the person. So having those pictures ready. Having information about your loved one already compiled that you're just ready to give to the local police department. The Alzheimer's Association does have a program called Medical Alert Safe Return that can do that for them. Knowing your local police department, knowing to call 911 if your loved one goes missing. Identifying too, in your neighborhood, we know that people with dementia for whatever reason tend to go toward very dense wooded areas and areas that are not very populated.
So know the neighborhood location and the hazards.
Yep.
And we're going to have to call it quits right there, but can we have you on another show to talk about more of these things and these devices? Well, thanks for being with us today on Graceful Aging. You've opened up a lot of eyes with a lot of good suggestions, and I hope you found those helpful. And allow me to thank Lisa Gardner for being our guest today, and we'll see you next time on Graceful Aging.